right. Good afternoon, all. My name is Gregory Harris. I'm a peer advocate and community liaison at Compass Cares. I am joined here by Dr. Harold Katner, and today is May 18, 2020, in recognition of National HIV and AIDS Vaccine Awareness Day. First of all, I'm going to go ahead and introduce Dr. Harold Katner. He is a prominent member here in our community. He's been in the field for HIV for over 20 years now. I'm going to turn it over to him so that he can give a little background on himself.
Thank you, Greg. So I started working with HIV back in 1983. At that time, we didn't even know it was a virus. We didn't know what it was, really. And up until I came here in 1985, I was the first infectious disease doctor in this area. And we immediately opened up a clinic in my office because I think I saw the second case from this area reported. But those cases grew very quickly. And then I was very involved with prevention as well, not just education prevention to the community, but I got involved with developing protocols for physicians and nurses and other healthcare workers who were stuck with needles, trying to prevent transmission to those individuals. Subsequent to that, I was involved with establishing the Hope Center, which wasn't called that back then, back in 1989. In fact, we moved our clinic from our office to the health, Navicent is it called now, over to the health department. And that was in fact, it was a Friday the 13th, October the 13th, 1989, when it started.
Exact date.
Yeah, never forget. And that clinic has grown, obviously, over the years. It moved around a few times. And but it's been vital to help maintain coverage for our patients. And I had worked for the state for a while and in clinics here as well as in Gainesville, Dublin, Tifton, Valdosta. So I've worked at a number of clinics throughout the state.
Right.
And I work at a high-risk OB clinic, which helps take care of the ones who are infected and pregnant. And we also have a pediatric clinic here to take care of the children that were exposed during pregnancy, but also the ones that had it and caught it during pregnancy, or even sexually, in their teenage years.
Understood. Very, very well versed, I see.
Okay.
Yes. Alrighty. So again, I'm here with Dr. Katner, and as well as he's been in the field for over 20 plus years, and we are here at Mercer Research Study through Mercer University Clinical Research Department. And here in the community, we have a few ongoing trials and research that is going on at the moment that Dr. Katner, if I'm correct, is spearheading, correct?
Some of them are also Dr. Stevens.
Awesome.
Who also works with me.
Right, who's also another prominent doctor in the area in regards to HIV. If you would, Dr. Katner, if you would mention just some of the trials that you're overseeing at the moment.
Sure. So one of the trials that we're most interested in obtaining was the one that dealt with the injections. And we were lucky enough to get on board with those studies, and it's been several years now that we've been working with that. We've got 3 or 4 versions of that study. Basically, it's comparing 2 injections. One's called ropinirole, the other one's called cabotegravir. Once we're giving it every 2 months or every month, and looking at the difference of those populations to see if they responded the same. Okay. And thus far, with the data we have here, it looks like every 2 months is going to be as good as every month. The studies have been looked at by the FDA. They have not yet been approved. The drugs hopefully will come out soon. It's basically a manufacturing issue. Efficacy looks great. And the people, we also did a part of that study was to look at people accepting the injections. Right. Some people had no desire to take the shots, but for whatever reason they decided to join the study. Now they don't go back to the pills. So, awesome. Yeah, I mean, there's not you're not forgetting to take your medications.
Right. That helps with the line of patients who are not adhering and with following up with taking the medication and coming in for lab work.
Exactly. So, and the other nice thing about these drugs, they last a whole year. So, but the problem is the levels of the drugs are not high enough during that entire year to keep the virus suppressed. Okay. So early data looked like 3 months would be enough, but I guess to be safe, they decided just to go every 2 months at the max.
Right.
Hopefully the FDA will prove it at that level. And it's going to be, it has to be 2 injections every 2 months, but it looks like it's an amazing
Pretty
study.
good.
Yeah.
Interesting, interesting.
Dr. Stevens has a study that is looking at a subcutaneous injection that will be able to give it every 6 months.
Okay.
And that's a naive study. We haven't had anybody enrolled in that, but we're trying very hard to get.
And when you say
people.
subcutaneous, is that going to be, you say every 6 months, so would
Yeah.
that be like an extended release of some sort?
Yes, and it's the way these things are. Yeah, so there's like it's like an extended. You're right. So it's not like some of these implants. This
Right.
is an injection, but the amount of material that's there it leaches out very slowly into the tissues and into
Okay.
the bloodstream. And again, it's a phase 2 study, so it's still early in the study. But if that works, that'll be great. Now the thing is, you still have to match it with something else. You just can't do a
Right.
single agent. So, but there's even talk about a once a year study, once a year medication. I don't know any data about that at all. But that's where we're going. We're trying to develop drugs that can be given less often and given in ways that can be easy, as far as
Right.
yeah.
Gotcha.
We have another study that we just got, and that study is enrolling it as we speak, and it's a study that looks at a medication by mouth that called islatravir, I can barely pronounce it, and doravirine, and that medication, islatravir, may be able to give that one once a month, so by mouth. So right now we're doing it every day,
Right.
so we're going to monitor levels, but if the levels are good, we may be able to expand an oral medication to once a month. So that's going to be really interesting.
Okay.
Some of the other studies we're doing are prep studies, in fact, eventually they may do these injections as prep studies.
Oh,
And so,
awesome.
Yeah, so,
That's very beneficial.
yeah,
Then you don't have to worry about them taking the pill every day as well.
that's right.
Okay.
So anyway, so there's a lot of things we're doing here, and so we're also looking at side effects of the drugs, like for patients that are taking integrase inhibitors.
Right.
Some of these drugs have been associated with, we think, increasing weight gain, and so they're looking at those medications to make sure, is that really a true complication of the drug,